guys, you are welcome to DSSG Nation. So if this is your first time watching the video from DSSG Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create a video. So today we are going to be talking about nephrotic syndrome. So pick your paper and your pen and let's get started. Alright guys. Yeah, welcome back. So I said we are going to be talking about nephrotic syndrome. Nephrotic syndrome. So the word nephrotic denotes the nephron, and the word syndrome, it means the combination of signs and symptoms. Combination of what? Combination of signs and symptoms, but that's not the end. That presents itself as a disease. That presents itself as a disease, or themselves rather. So nephrotic syndrome. So the word syndrome itself means combination of signs and symptoms that present themselves as a what? As a disease. So it means this nephron is going to be diseased, is going to be affected, and it's going to bring about different signs and symptoms altogether. So, with the fact that it's a syndrome, so that gives us what we call the nephrotic tetrad. Nephrotic what? Nephrotic tetrad. So, what are nephrotic tetrads? So, there are the four major signs or major symptoms of what? Of nephrotic syndrome. So, the first one is called hyperalbuminuria. So that is one. The second one is called hypoalbuminemia. So the third one is called hyperlipidemia. And the last one is called edema. Now, these are the what? The nephrotic tetrad. Of course, in some other textbooks, they can change this edema to something else. But based on this, these are the what? The nephrotic tetrad. So what is the meaning? The word hyper means high level of something. High. So albumin, it denotes that plasma protein known as albumin. So what is albumin? I'm going to be talking about that after clearing this board. Now, what is the meaning of urea? Urea denotes urine. So if you say hyperalbuminuria, it means high level of albumin in urine. So the second sign is called hypoalbuminemia. Hypo means reduced level of something. So albumin is that albumin proper. And then anemia, okay, this word anemia means blood. So if you say hypoalbuminemia, it means reduced albumin in blood. Now, hyperlipidemia, this word lipid is denoting the fat. So, emia is blood. So, this is high lipid in blood. And lastly, edema is just the accumulation of fluid in the tissue space. So, I'm going to clean the board and we'll talk about albumin. So, stay tuned. Yeah, welcome back. So let's talk about albumin. So what is the function of albumin? So albumin is a type of plasma protein. We know that we have majorly three plasma proteins. We have the albumin, the fibrinogen, and the globulin. So this albumin is where we are going to in nephrotic syndrome. So what is the function of albumin? To understand that, we have to take a careful look at the capillary bed. So I'm just going to do some kind of brief introduction to the capillary bed. So the capillary bed, let's say at the microscopic level rather. So at the microscopic level of the capillary bed, it looks like this. Now, this is the microscopic structure of the what? Of the capillary bed. So within this place, the blood is running. The blood is running within this blood vessel, within the blood stream right here. And these cells, they are supposed to what? They are supposed to feed. Don't forget, the function of the capillary bed is to serve as a site of exchange for what? For gases, nutrients, any other thing that needs to be exchanged. So now, these cells, they are supposed to what? They are supposed to eat. So with the presence of this pore, the nutrients in blood, they are going to be coming into the blood through the what? Through the pores, into the cells rather. So into the what? Into the cells. So through these pores into the what? Into the cells. So these cells, they are going to what? They are going to feed. And when they are done eating, they are going to produce what? Byproducts. Their own what? Their byproducts. So these byproducts is supposed to come back into the what? Into the blood. So it means exchange as what? Exchange has occurred. The blood is given this way, and then these cells too, they are doing what? They are giving back this way. So that is why it is what? A site of exchange. But that is not what we are going to. Now, during the time of exchange from the blood into the tissue, movement of nutrients from the blood into the tissue is actually done with the aid of fluid. So the fluid is moving these nutrients into the cells. So as the fluid is moving it, those fluids are going to be escaping into these spaces. This space is called the tissue space. Tissue what? Tissue spaces. So tissue space strictly. So the fluid is going to be deposited there into the what? Into the tissue space. During the what? During the movement of nutrients from what? From the blood into the cells. So fluid are going to be escaping as well. Are we getting that? So this fluid, they have to go back into the blood. So this second arrow will now take them back into the what? Back into the blood. And these two arrows, they denote two things in the capillary bed. And those are the two pressures in the capillary bed. So the first one is called the hydrostatic pressure. Hydrostatic what? Hydrostatic pressure. So this hydrostatic pressure is the one responsible for this arrow. It forces fluid and nutrients out of the what? Out of the bloodstream into the what? Into the tissue spaces to meet the cells. The second one is called the osmotic pressure. Osmotic what? Osmotic pressure. If you know nothing about this, just watch our video on the cardiovascular system. Just type capillary bed by the SSG nation. You are going to get a better understanding of this. So now, this osmotic pressure, the function of osmotic pressure is to bring all this fluid here back into the blood. But what is responsible for maintaining this osmotic pressure? It is this guy here called albumin. So if there is no albumin in the blood, osmotic pressure will not be functioning. So this fluid will not be able to go back into the what? Into the blood. Now, let me quickly do a recap of that into this place. Now, let's say we have a tube right here, and the tube has pores. So while pouring water into this tube, some are escaping into this place. Are we getting it? So if we drop albumin, if albumin is a drug, so if you drop a tablet of albumin inside this place, it is going to draw in all this fluid. It's going to draw in all this what? All this fluid from this place back into the what? Into the bloodstream. But if there is no albumin, there will be nothing to do what? To draw this fluid back into the tissue space, back into the blood rather. So that is the function of albumin. It is responsible for maintaining the osmotic pressure. So if there is no albumin in the body, or we have a reduced level of albumin, there is going to be accumulation of fluid inside the what? Inside the tissue space. Now, let's go into the nephrotic syndrome proper. So, stay tuned. Yeah, welcome back. So, we're talking about nephrotic syndrome. Nephrotic what? Nephrotic syndrome. Now, we said the nephrotic syndrome, the nephron is affected. So let me just bring in a diagram of the nephron. So we have afferent arteriole. Let's do it this way. Let's follow it this way. So the afferent arteriole, the capillary bed, which is the glomerulus, and the efferent arteriole. So right here we have our what? We have our glomerular capsule, also called the Bowman's capsule. Bowman's capsule. And we have the proximal convoluted tubule. So the proximal convoluted tubule. And then we have our what? We have our loop of Henle. The loop of Henle. So after the leukocyturia, we have the what? We have the distal convoluted tube. The distal convoluted tube. And we have the collecting ducts. Now, this is just the diagram of the nephron. It's sketch to be precise. Now, we know that this structure here is called the afferent arteriole. If you are yet to watch our video on the nephron, just make sure you stop this video and go back there. Or let me just do this. I'm just going to drop a link up ahead. So after this video, you can check it. Now, this is the what? The afferent arteriole. And the function of the afferent arteriole is to do what? Is to allow for the passage, of what? Of blood into this glomerulus. This structure is the glomerulus. It has pores. It's just like sheath. So, and this sheath is going to allow some things to escape down into what? Into the proximal convoluted tube, right from the human capsule. So it comes down to the what? Into the proximal convoluted tube. Now, one of those things that are not supposed to leave the blood is called albumin. That is what we were discussing the other time. So, this albumin, it has some kind of large molecular size. So it's not supposed to pass through that pore. Now, when there is any kind of damage to this glomerulus, so this albumin is going to need to escape. And what are those things that can lead to what? Damage to this glomerulus. Those are the causes of nephrotic syndrome. So what are the causes of nephrotic syndrome? We have infection. Infection. So 2, trauma or some kind of damage or injury. So apart from that, glomerulonephritis can cause nephrotic syndrome. Glomerulonephritis can cause nephrotic syndrome. And after that, we have the minimal change disease. Minimal change disease. So we are supposed to be talking about the reason or how this disease leads to what? Leads to nephrotic syndrome. But just to cut this video short, not to make it a very long one, we are going to be talking about this in some other videos. So now, all these things can cause what? They can cause nephrotic syndrome. So in nephrotic syndrome, these pores that are small, they are going to become large. So this place is going to become damaged. And when this glomerulus is damaged, this albumin that is big or that has a large molecular size will be able to pass through. And when it comes downward like this, what's going to happen? It's going to continue its movement to the leukocyturia, then to the distal convoluted tube, and then to the collecting ducts. And then it is going to be found in what? In urine. And that is going to bring in our first nephrotic tetrad, which is called what? Hypoalbuminuria. Albuminuria. So, escape of albumin is going to lead to what? Hyperalbuminuria. Now look at it. This albumin is escaping from somewhere. Where? We said this afferent arteriole comes into the glomerulus with what? With blood. So it means albumin is escaping from the blood into urine. So now imagine you have 10 balls in this bag and you are pouring it into this surface, onto this surface rather. As they are leaving this bag into the surface, their number is going to be decreasing within this bag. So if they are losing albumin into urine and the albumin is coming from the blood, it means the level of albumin in the blood is going to be reducing, and that should bring about the what? The second tetrad called what? Hypoalbuminemia. Albuminemia. So hypoalbuminemia will set in due to what? Due to hyperalbuminuria. So there's going to be escape of what? Of albumin in urine. But the level of albumin in the blood is going to what? Is going to reduce. And after that, what is going to happen? With the fact that albumin is leaving the blood, the next thing that is going to happen is that the osmotic pressure of the blood is going to be lost. There will be nothing to bring back the fluid into the what? Into the bloodstream. Don't forget the capillary bed, what we talked about in this previous scene. So this albumin, due to the low level of albumin in the blood, there is going to be what? A reduction in the osmotic pressure, which means fluid are going to be what? They are going to be trapped in the what? In the tissue space. So the fluid will not be able to do what? Fluid will not be able to come down back into the what? Back into the blood. So and this is going to cause what we call edema. Edema. So the fluid will not be able to move back because albumin is no more in the blood, to do what? To promote the osmotic pressure, the pressure that brings fluid back into the what? Into the blood, and that is going to cause what? Edema. Edema is the accumulation of fluid in a certain space, the tissue space to be precise. Now, let me clean the board and continue running the pathophysiology. So, stay tuned. Yeah, welcome back. So, let's continue the pathophysiology. So, we know that this is the what? The afferent arteriole. And the afferent arteriole is going to come from some series of breakdown or branchings of the abdominal aorta. We all know our blood flow, the arterial supply to the kidney. It will start from the what? The abdominal aorta. From the abdominal aorta is going to branch into the renal artery. From the renal artery is going to become the segmental. From the segmental it becomes the interlobar. From the interlobar it forms the arcuate. From the arcuate it forms the cortical radiate. And from the cortical radiate it forms the afferent arteriole. Now, from the afferent arteriole right here, it means it comes from the what? From the abdominal aorta. So I'm going to call the other what? The other branchings. So I'll just connect it directly with what? A vessel right here. So let's accept that this vessel is just the abdominal aorta. Or let's say it's just a proper vessel within the body. Sure, we get that. So let's take it as what? A proper vessel within the body. So we have our what? We have our nephron right here. We don't really need the nephron anymore, so we can just draw a sketch. So just something minimal. Or something minor rather. So collecting dots right here. Now, we said with the fact that we have the person has hypoalbuminemia, which means reduction in the what? In the level of albumin in blood. So we said there is going to be escape of what? Escape of fluid into the what? Into the tissue space, and that is what we call edema. So this edema is going to affect different body parts. So edema to the legs, that is going to cause pedal edema. Pedal what? Pedal edema. And this is going to affect the eye as well. So surrounding the eye, the edema is called periorbital edema. What? Periorbital edema. So periorbital edema. And then to the brain, the person is going to have cerebral edema. And then to the abdominal region, that is going to cause ascites. So ascites. So and different kind of edema. And now, with the fact that there is hypoalbuminemia, edema is going to set in. Then the body is going to notice this, that there is low level of albumin. And then that is going to send an impulse. It's going to send a message to the what? To the liver. And what will happen within the liver? So the liver is going to try to produce albumin for the body. And don't forget, I said albumin is what? A plasma protein. So the liver is going to produce what we call lipoprotein. Lipo what? Lipoprotein. So this protein is going to be used to form what? To form albumin. But what will happen to the lip that ends this place? This lip also means lipid, which is same thing as fat. Fats. So this lipid, they are going to be free floating within the blood. That is, they are going to be floating freely within the what? Within the blood. And they can form some kind of clot or plaque within the what? Within the blood vessels. And that is going to cause another condition called atherosclerosis. So atherosclerosis. And when this occurs, it increases the pressure of blood. It increases the what? The pressure of blood, and that can cause hypertension. So that is a complication of what? Of nephrotic syndrome. So that is our third tetrad, which is what? Hyperlipidemia right here. So, like a quick recap for this, due to hypoalbuminemia, the liver is going to produce lipoprotein. The protein is going to be used to produce albumin in order to correct the edema. And this lipid is going to be free floating in blood, and it's going to cause atherosclerosis. And that is after it causes hyperlipidemia. So it's going to cause what? It's going to cause hypertension. So you can stop running the pathophysiology at that point, because it has been run to what? To complication, which is hypertension. Although further complications can set in. So the RAS can be triggered as well. The RAS is the renin angiotensin aldosterone system. So, but let's just leave that. Now, a quick recap. We said the person is going to what? Is going to be urinating albumin, and that is going to cause hyperalbuminuria. And after that, we said with the fact that there is a large amount of albumin in urine, the person is going to have hypoalbuminemia, that is low albumin in blood, because albumin is leaving the blood to form what? To form urine. And after that, we said low albumin is going to result into what? Edema of different body parts. So we talked about the pedal, we talked about the periorbital, we talked about the cerebral, which is manifested as headache as well. So we talked about ascites in the abdominal cavity, and then generalized edema council setting. So in either the body part is going to be edematous, and then the person is going to have pulmonary congestion too. So and that one can be manifested as dyspnea, difficulty in breathing. So after that, we said the body is going to sense a low albumin, and the liver is going to produce lipoprotein. So this protein is going to be used to form new albumin, but this lipid is going to be free floating within the blood, causing hyperlipidemia, our third tetrad rather. So and after that, we said it can become atherosclerosis and shoot up the what? Shoot up the blood pressure, which causes hypertension. So I take it that you enjoyed the video. So if you do make sure you give it a thumbs up. And if this is the first time watching the video from the SSG Nation, do make sure to subscribe and hit the bell button so we can notify you whenever we create a video. Hi guys.
No.